If you have ever felt a little fear rise in your chest when you hear the words pregnancy, labor, hormones, or birth, you are not dramatic and you are not weak. You are human. Your body has always carried stories bigger than what most people ever stop to understand. Maybe you have wondered what labor really feels like. Maybe you have worried about what could go wrong. Maybe you have heard women laugh off terrifying experiences as if pain is just part of being female and silence is part of surviving it. So before anything else, I want you to feel this clearly. You deserve truth, you deserve compassion, and you deserve information that does not shame you, scare you for no reason, or leave you alone with questions. And here is the hard truth that should stop you in your tracks. Sometimes the most dangerous part of birth is not pain, and it is not blood, and it is not even the contractions you were warned about. Sometimes the danger begins with direction. Sometimes the difference between life and death, especially throughout history, was whether a baby came head first or feet first. Think about that. One turn, one position, one moment inside the womb. That is all it could take to transform a normal birth into a race against time. When most people picture birth, they imagine the baby coming head down, the cervix opening, the body working in the order it was designed to work. But not every baby follows that path. Some babies settle bottom first. Some come with their legs folded up. Some try to enter the world feet first, and that is where the fear becomes real. Because when the feet or bottom come before the head, the body can slip through before the cervix is fully ready for the widest part. And the widest part is the head. That means a baby can partially deliver and then suddenly, terrifyingly, get stuck. Imagine that tension. Imagine being the mother, exhausted and pushing with everything in you. Imagine being the one beside the bed, watching half a baby born and knowing the next few moments matter more than almost any others in medicine. That is not drama, that is obstetrics. That is why breech birth, especially footling breech birth, has historically been one of the most dangerous ways to be born. And if you are listening to this as a woman or someone raised in a female body, I need you to hear the deeper truth underneath the medical facts. Your fear around birth did not come from nowhere. Generations of women before you knew in their bones that childbirth could turn without warning. They knew what it meant to pray through labor, to listen for a first cry, to wonder whether they or their baby would survive the night. Even now, in a world with monitors, ultrasound, surgery, antibiotics, blood banks, anesthesia, and trained teams, birth can still demand everything from you. So no, you are not overreacting if this topic shakes something in you. You are responding to a reality women have carried for centuries. What makes breech birth especially intense is how deceptive it can be. Pregnancy can look normal. You can feel kicks, feel pressure, feel hope, and still not know the baby is positioned in a way that may change the entire birth plan. You may have heard myths from older relatives, from social media, from neighbors who swear they can tell the baby's sex or position by how low you carry. Whether you crave sweet or salty food, whether your belly is round or narrow, whether you have morning sickness or glowing skin, these stories can feel comforting, even funny, but they are not reliable medicine. They are the language women created when they were forced to guess. And there is tenderness in that, but there is also danger in pretending a guess is knowledge. Modern care changed that. Today, if a baby is breech late in pregnancy, your provider may confirm the position by exam or ultrasound. Sometimes a trained clinician can try to turn the baby from the outside, using hands on your abdomen in a procedure called an external cephalic version. It sounds simple when you say it fast. It is not. It can be uncomfortable. It takes skill. It does not always work. And it is not right for every pregnancy. That matters because too often women are told about birth as if every body follows one clean script. Your body does not owe anyone a perfect story. Medicine is not magic. It is judgment, timing, skill, support, and risk weighed carefully. And if the baby does not turn, this is where honesty matters. In many settings today, especially where surgical care is available, a planned cesarean birth is often recommended for a breech baby because it lowers certain serious risks. That does not mean vaginal breech birth never happens. It does. In some places, with very specific criteria and highly trained providers, it may be considered. But what you need to understand is that breech birth is not dangerous because women's bodies are failures. It is dangerous because anatomy matters, timing matters, and minutes matter. Your baby's body can emerge while the head remains trapped. The umbilical cord can be compressed. Oxygen can fall. A situation can go from controlled to critical faster than most people are emotionally prepared to imagine. And this is the part that hits women so deeply. You are expected to be calm while carrying possibilities that would overwhelm almost anyone. You are expected to smile through swelling, nausea, fear, insomnia, and strangers touching your belly like your body became public property. You are expected to make the right choices while flooded with hormones, advice, myths, and judgment. And when something complicated like breech presentation happens, the world suddenly speaks in urgent tones, and you are supposed to absorb it all while still being strong. But strength is not pretending you are fine. Strength is letting yourself understand what is real and still moving forward. Picture that moment late in pregnancy when you realize the baby may not be head down. Your heart drops. Suddenly, every kick feels loaded. Every appointment feels heavier. You start asking questions you never wanted to ask. What happens if labor starts tonight? What happens if my water breaks? What if I live far from the hospital? What if no one catches it in time? What if the birth I pictured is not the birth I get? And underneath all those questions is another one. So many women are afraid to say out loud, "Will I be safe?" That question deserves a real answer. Safety does not come from pretending bad outcomes never happen. Safety comes from being seen early, listened to clearly, and cared for by people who know the difference between normal, uncomfortable, urgent, and life-threatening. Safety comes from access. Access to prenatal care, access to imaging, access to emergency treatment. Access to people who do not dismiss your instincts. Because the most heartbreaking thing is not that birth can become dangerous. It is that so many women still face danger without support, without information, or without anyone taking them seriously soon enough. And if you have never given birth, this still matters to you. It matters because women's health is not a niche subject. It is your future, your history, your family, your friendships, your hormones, your periods, your fertility, your losses, your choices, your right to understand what your body may one day face. It matters because so many girls grow up learning more about embarrassment than anatomy, more about being proper than being informed, more about hiding pain than naming it. Then one day they are adults, expected to navigate contraception, miscarriage, labor, postpartum recovery, and hormone changes with half an education and twice the shame. You deserve better than that. And if you are older, if you have already given birth, if you carry memories you rarely speak about, I want you to know that your story still matters too. The women who came before this era of safer birth were not weak. They were astonishingly brave. They labored through risks modern medicine now prevents every day. They buried babies. They survived hemorrhage. They feared breech births, obstructed births, infections, and silence. Some of them were told nothing. Some of them were expected to endure everything. Their resilience should be honored, but their suffering should never be romanticized. Because there is nothing beautiful about women having to guess in the dark. There is nothing noble about preventable danger. There is nothing empowering about being uninformed. Real empowerment is this: knowing that a breech baby is not your fault. Knowing that needing help is not failure. Knowing that a cesarean birth can be life-saving, not lesser. Knowing that fear and courage can exist in the same body at the same time. Knowing that if your pregnancy, your period, your hormones, your pain, or your birth story does not look neat, you are still whole. So when you hear the phrase, "the most dangerous way to be born," do not hear it as a horror story meant to frighten you. Hear it as a call to pay attention. Hear it as proof that women's health deserves seriousness, funding, access, research, and respect. Hear it as a reminder that your body is powerful, but power does not mean invincibility. It means wisdom. It means preparation. It means not waiting until crisis to believe women deserve excellent care. You were never meant to go through these realities armed only with myths and whispered warnings. You were meant to have answers. You were meant to know what your body is doing, what your options are, what the risks mean, and when to ask for more help. You were meant to be spoken to with dignity, not condescension. And above all, you were meant to understand that even in the most frightening moments, knowledge can soften panic, preparation can save lives, and being informed is one of the most loving things you can do for yourself. So if this shook you, let it wake you, not break you. Let it remind you that your body deserves attention before an emergency, not only during one. Let it remind you to ask questions, to seek care, to trust your instincts when something feels off, and to stop apologizing for wanting real explanations. Because when women understand their bodies, fear loses some of its power. And when you understand the truth, even about something as frightening as the most dangerous way to be born, you do not walk away smaller, you walk away clearer, wiser, and far less alone. The baby who comes. Feet first, the hidden danger. Women deserve to understand.